Posture can have a dramatic impact on our breathing, our breath volume, our entire experience with our breath response. So it's important to look at postural elements that could be impacting our breathing. Hi, this is Dr. Peter Minke, and you're watching Minke Wellness. We are doing this year-long journey, and we're starting with the respiratory system because it's so important to get enough oxygen and breath and air into the tissue and then get rid of that carbon dioxide that's coming out. And if I'm restricted even just a little bit in my breath volume, my ability to exchange that oxygen for carbon dioxide, that's going to have a dramatic impact on my overall wellness, okay? And so there are definitely some things that we can look at and impact or change that would have a benefit to us in terms of getting more volume. So I'm going to show you, I'm doing this seated on a stool so you can see some of these things, but I'm going to show you some of the elements of posture support and as it relates to breath. So I'm going to back up just a little bit so you can see my whole sitting position here. And as I sit in a chair, and you'll notice that most people sitting at a desk, you know, kind of hunched over. We would all know that being hunched over at a desk, how am I going to get a deep breath? I mean, my whole system is crunched over. I'm not going to have good digestion. I'm not going to have good breathing. Maybe I'm even going to have problems with my neck. Maybe even develop sinus, jaw, and hearing problems because all this tension creeping up from here. So this position that many people are spending a lot of time on, and or with their devices or their laptop or whatever it is, this is killing us. I mean, I'm not kidding. This is literally killing us. It is accelerating the whole aging process and preventing us from being well because it cuts off the good fluid and circulation, and we're not getting good fluid flow in the body. We're not getting good air. We're compromising our digestion. How can we be healthy and well, right? So posture obviously can have a huge impact. Every day we are making decisions about how we are in our body, and if we're unconscious about it and just slouching around and all that, then we end up with long-term, every day, accumulating extra tension and compression. We may even end up with disc problems, blowing a disc in the spine, or something like that that would be even more severe than just having, less health, okay? So let's look at this from a standpoint of what can I do? What are things that I can do to improve my posture? Now, first of all, I don't know if you'll be able to notice this, but I'm sitting with my pelvis higher than my knees. So not everyone is the same height. Not everyone's body and lengths are the same. Some people are long leg, short leg, whatever. But the bottom line is if my pelvis is slightly higher than my knees, I know you'll see in the ergonomic books that everything should be 90 degrees. And so if I put myself at 90 degrees, I don't know if you can tell this, but the pelvis starts to tip backward. Okay, so it's like I'm sitting in a hole. So if the pelvis is way back here and I'm losing my volume, this position actually encourages a slumpy posture. Whereas if I go up in height, it encourages a more neutral posture where I'm actually standing or sitting more upright. So this is the benefit of having the pelvis slightly higher than the knees. All this comes out of the kinetics model by Judith Aston, the Aston paradigm, A-S-T-O-N, and we'll put a link in the video so you can catch more of her stuff. If you can learn how to understand how the body works mechanically, lots of things get improved and get better, okay? So we're talking basic posture and support for the breath, and we know the diaphragm is part of the breath and the chest is part of the breath. So if we support, structurally, physically support the diaphragm and support the chest, we're going to have a better time activating this, what we call breath. If the pelvis is back here, I'm not going to be able to breathe. Okay, so we went over this yesterday, but let's go over it a little bit more from a standpoint of what are the musculature down here. We say, okay, yeah, we know the muscles up here in the chest or muscles in the diaphragm, but what's happening down here? As the psoas, which is the deep muscle way back in the back, if that's short, or the hamstrings are short, which is a lot of times a sitting posture, if we sit too much, we end up with this, then I'm going to be pulled short and held there, and I'm not going to be able to have a deep breath as we talked about yesterday, if you want to watch yesterday's video. So I'm not going to be able to get a deep breath if this is restricted. So this becomes very important posturally for me to sit. Now, this is all talking about sitting, all right, but what about standing and walking? Is there anything that I can do? So first of all, like I said, what we can do is bring our chair height up if we're sitting at a desk, okay? And that gives us that, right there alone, that can make a huge difference to most people. You also want to look at your chair, and if it's scooped out like you're sitting in a hole, and anything that's going to encourage the pelvis to be sitting back here in a hole is not going to be helpful. So you want to maybe put a cushion in there to get the body sitting out, not out from sitting in that hole. Now, here's the thing, as I sit here in the hips, the chest is supported by the hips. In other words, if the hips roll backward, the chest falls. If the hips roll forward, the chest goes forward. So when Grandma was telling you sit up straight, what you heard was sit up straight, which is to contract your back, pull your shoulders back, pull your head up, and sit up straight. But if I don't change the base, right? This is the base, is what I'm sitting on. If I don't change the position of my hips, I'm not going to be as good, or it's not going to get, it might be as useful. So Grandma's advice really should be roll your pelvis forward, okay? So now every time you hear in your head, sit up straight, kind of add that piece, sit up straight by rolling your pelvis forward, right? So just add that little piece in there, sit up straight by rolling your pelvis forward. Now, most people, as I said yesterday, most people are posterior. They're sitting like this, and they really need to have that thing. There are some people who are going to be already very strongly anterior, and so they don't need that encouragement. So you have to watch for that. Okay, so here we are. We're able to roll our pelvis forward, sit up a little bit straight. Sometimes you can scoot your hiney into the back of the chair, the back part of the chair, so that encourages this position of being slightly more forward. And so here I am. Oh, I can already feel how I can breathe. Remember in choir, if you were ever in choir, they said sit on the edge of your seat, sit on the front of your seat. Why does that do? That allows you to drop your knees, opens up this whole part down here, and that's where we're going. Right? So we already know this. This isn't a surprise for anyone who's a singer. We need breath support. Well, everyone should be a singer from a context of breath support, whether you sing or not. You need breath support. Okay, so now the question is, what happens when I go to stand up? And I'm going to probably go out of the video frame here, but when I stand up, most people will stand up by kind of leading with their head, right, and then pulling their body up with their shoulders and their head, right? So they lean forward and lift up, and I get up off my chair by lifting myself with my shoulders and my head and my neck, creating tension, compression in the head, neck, and shoulders. Is that a good thing? No. Okay. So one way to pay attention to this is to realize that once I have this support here, the chest is sitting on top of the pelvis. If the pelvis rolls forward and my movement initiates from the belly, right, as my belly moves forward, I now position my body on top of my feet, which it's the legs that push me up to standing. Do you see that difference? One of them is lifting with the shoulders, right, and the other is coming over and pushing up from the floor. And if you can experience these two things on your own, you'll feel how much powerful the legs are to push me up, and I can get that power by putting the pelvis, moving the pelvis first, hinging the body forward. Now a lot of people will do it this way. They'll hinge the pelvis forward, but they'll leave the head and end up in this position here, right? Getting up with their head cocked back. This is not doing any work. We just want to relax, bring the body forward like it's a ship rocking at the ocean. If this was a ship, mast of a ship, we just want to stay in. The whole body has its line here. We hinge forward and then push up, and the legs are doing all the work. Okay? So that, I promised you we would talk a little bit about bras, but that's our sit to stand, right? That's what happens if I stand up correctly with my legs. Now, of course, that means when I sit down, I want to stick my hiney out and sit down, and again, that work is all taken in the legs, right? So you want to practice this of sticking your hiney out a little bit, pushing up with the legs, sit back down with your hiney sticking out, and then we sit there, and there I am. I've got the good position, good support for my breath. Now, let's talk about bras. Now, I've never worn a bra, so you'll have to bear with me on it, but the mechanics are clear that if I take an elastic band and I wrap it around my rib cage and then secure it, it's going to have an impact potentially on my ability to expand my breath and it can close here and it can close here. And so these are two areas that can have a dramatic impact on my ability to breathe. So how I put the bra on, this is an elastic band. A lot of times you'll see people, now I want you to watch the shape of my chest, and if in the context of lungs and breath, if I put my bra on like this and I attach that elastic band, what's the shape I've just secured into my chest? I have just secured this shape into my chest, and it's going to fight me all day long. I'm never going to get a deep breath with that position. So what I'm going to advocate for you is to put the bra on in the front. Now, even if it's a back clasp bra. Now, but again, a lot of times, if you put it on like this, looking at the clasp, and you clasp it like this, what's the shape of my chest? I'm in the same problem, okay? So I really need to maintain a neutral chest position, clasp the bra, and then make the adjustments, twirl it around, get the arms set, and the rest of that like that. So the very important placement is not so much whether the bra is front or back clasp, but it's what shape my chest is in, what position my chest is in when I make that securing action. So when I clip that bra on, that's going to dictate that shape and compression. Now, what's the impact of having that chest compressed with an elastic band? Well, obviously I've been talking about breath volume, but we also have the problem of lymph drainage, and we'll talk a lot more about that next month about lymph. But the breast tissue is lymphatic tissue that drains, and it has to drain properly through this area right here. Well, if I have an elastic band that runs right underneath the drainage points, and then another elastic band that compresses here, the other drainage point, which is here, how in the world am I going to have a healthy breast if I'm constantly blocking the drainage of all that tissue with an elastic band? So you can see, hopefully, the benefit of understanding mechanics on a bra thing. So these are the two issues we've talked about: having support for the breath, both in sitting and in standing, and then talked a little bit about troubleshooting the mechanics of bra ergonomics, is what I call bra ergonomics. So hope this has been useful. If you have some questions, if you're on our Facebook group, go ahead and ask me on the Facebook group, and we can try to troubleshoot some of these things if you need more clarification, okay? Happy wellness, and we'll see you tomorrow.